A neurosurgeon saved the life of a 19-year-old girl by removing a brain tumor through her eye. Kayla Flores was 18 years old when she began experiencing double vision, and her ophthalmologist referred her to a neurosurgeon. Please make sure you follow me on Facebook, Crushing T1. On the morning of Kayla's surgery, she went in and got an MRI. The technician positioned the camera a little lower than normal, and he discovered a second tumor wrapped around her brainstem. This tumor is called a chordoma, and it's extremely rare, and there's only about 300 diagnosed every year. Doctors told Kayla that if they hadn't seen the second tumor, she could have become paralyzed. They decided to go ahead with the surgery and remove this tumor through the traditional approach going through her nose. The first surgery was a success and the tumor was fully removed. Afterwards, the surgeon consulted with his colleagues who told him he should just put his patient on comfort care because this second tumor was inoperable. Well, that answer was not good enough for Dr. Mohammed Labib out of the University of Maryland Medical Center, so he spent the next several weeks going into the neurosurgery lab and studying the location of this tumor. During that time, he used cadaver heads and skull models to ensure that he could safely reach the location of this second tumor. As soon as he was confident that he could reach the location of the tumor safely, he approached the parents with his plan and they agreed to proceed. In the operating room, the neurosurgeon worked with a facial reconstructive plastic surgeon to remove the lower portion of the eye socket and part of the cheekbone. The surgery took a total of 20 hours to perform, but it was successful in removing the tumor. And 6 weeks later, Carla underwent radiation to ensure that all of the cancer was gone. And we are now a year out from surgery and she has no evidence of any cancer in her body. This was the first time that this surgeon used this surgical approach to remove a brain tumor. This is a picture of Carla and her cat, and she goes in every few months to get checked out, and so far everything's looking good. Her doctor believes that this approach could be used on other patients with difficult to reach tumors in the upper cervical vertebrae area.